Hello everyone, and welcome once again to Health and Family. Today we're talking about an issue that has affected many of our young people. Concern is rising in the community that many of our young people are fascinated by the act of vaping. So some of you may be asking, what is vaping? We will explore that topic today with the Minister of Health, the Honorable Kim Wilson. Later in the show, we will be joined by the Education Officer from the Bermuda Cancer and Health, Mrs. Azuree Williams. At this time, we welcome you, Minister, to our program.
Thank you. Thank you.
So we'll start off basic. What exactly are vapes or vaping?
Okay, so vape is a product it's a battery-operated product that normally emits flavoring, other type of toxics, and nicotine.
Okay.
So the person inhales it through this aerosol, and the act of doing that is called vaping. And what we're seeing, unfortunately, is an increase of vaping within our community, particularly amongst our youth. And it's a very, very dangerous practice. Like I said, nicotine is in it, and so we know that nicotine is an addictive product, so therefore it will impact individuals as it relates to health consequences and so forth. So it's very serious. We've seen an increase in the rise, particularly with respect to youth, and it's certainly something that needs to be addressed.
Yeah, I mentioned to you, I work in our school system, in our high school system, and as a consequence for students doing vaping, they are suspended, and then they come back, and they just don't get it. Like, what's the big deal? So I was just doing that. And so I was trying to liken it to when I was a youngster, their age, where smoking was the big thing. Right. So I'm thinking, is that maybe some kind of correlation to it or to that effect? I'm not sure.
Yeah, I think you're right, because generations ago that was like the hip thing. That was the thing, was the smoking. But what we're seeing now is it's almost like the big tobacco industry has replaced the tobacco smoking with this, because they're trying to entice our youth. And the vaping products that are out are candy flavored, cotton candy, ice cream, things that will entice youth. The packaging is so colorful.
The marketing. They've done an
excellent
job
of
marketing. And I think that's why a lot of youngsters are saying, what's the biggie? It tastes like bubble gum, whatever, watermelon, whatever.
Yes.
But let's compare the two. So smoking when I was some 30 years ago, whatever the case may be, to today, both have their effects, but is one better than the other? I mean, if I had to say it like that, I shouldn't say it like that. Let me rephrase. None are good, obviously.
Correct.
But which one? Because the way that it's been marketed is that vaping is not as dangerous as cigarette smoking. You want to expand on that for us?
Certainly, Ms. Burgess. And as you say, it is not as dangerous. So the word danger still exists. So it is still very dangerous. The regrettable thing is that some of the products that are on the market, in addition to containing the flavorings like we spoke about, which are okay to consume but not okay to inhale.
Right.
And they also have nicotine, but some of them may have certain other types of heavy metals, formaldehyde, and other kind of dangerous toxins that are in the product itself, in the vape canister itself. And so sometimes I hear the argument where people say, well, they're less dangerous, but they're still dangerous.
Right.
So,
and it is still addictive.
Absolutely.
And I think that's what people are not getting. And that I'm wondering to myself, as I said, I do this, one of my jobs as an ET is to integrate our students back from being suspended for doing that. They just don't get it. They're like, well, I don't get why I'm being suspended for this. So-and-so does it. What's the biggie? So,
well, and that's unfortunate. And I think, part of our process at the Ministry of Health is to continue education programs so that people understand that many of the vapes do contain nicotine, which is a highly addictive chemical.
Right. So, Minister, I wanted to ask you about, we're definitely going to get into the risk of vaping, but how are these kids even getting to buy this? Because if it's nicotine, because you mentioned that nicotine has to be sold by a pharmacist, so how am I, as a teenager, going up to the pharmacist and saying, I want to buy this? Talk to us about that.
That's a very good question. The reality is that what we've noticed is that there has been an increase in not only nicotine products, so not only the vaping, but the candies, the gums, and pouches and other things that contain nicotine. And so as a point of law, under the Pharmacy and Poisons Act, those products are only meant to be sold by registered licensed pharmacies.
Okay.
However, what we've seen is that increasingly they are being sold in retail establishments, at the cash register, next to the candies.
That is true.
Right? So the Ministry of Health is enforcing the law around that. However, it's important to recognize that because it is a drug, it comes under the Pharmacy and Poisons Act because of the nicotine content. I was in a particular establishment right before Christmas, and I noticed them in the right by the counter, right there by the candy. And I looked twice because it was colorful. I thought they were mints.
Right.
And I walked up to look and see what that was. But when I was checking out, the young man that was at the register, I said, what are those? And he shrugged. I said, so do you have to have an age limit? He shrugged again. So he didn't even know what they were. So it would have easily been accessible, I think, to anybody coming up there and spending their money.
And yeah, you're correct about that. I've seen it myself where you just go and you're getting some peanuts or something and I'm like, oh, okay, what's that?
Exactly.
Same thing. And you're like, oh, I didn't even think about a teenager going up there. So as an adult, I'm like, wow, okay.
Exactly.
So that anyway, that's another question, another show. Has in your estimation as a Minister of Health, I know you deal with a lot of topics, this has, without a doubt, I'm thinking, and tell me your viewpoint, has increased over the years. Within the past 5-10 years, it's really increased among our young people.
You're absolutely right. The e-cigarettes, the vapes, were initially introduced in the market to help people as an aid to stop smoking cessation, right? However, what we've seen is, and no doubt the big tobacco is trying to, capitalize on a youth market. So they, as you said previously, they're marketing them to youth, colorful packages, flavors, cotton candy vapes, ice cream flavored, et cetera, for the whole purpose of marketing to the youth. So what we're seeing, which is not just in Bermuda but worldwide, and this is statistics from the WHO, is that there has been a slight increase of use within the adult population, particularly for smokers and previous smokers, but there's a huge significant increase in the youth population and consumption. And again, nicotine is an addictive product, so we recognize that in addition to the health consequences as it relates to, particularly for adolescents, it slows down brain development, it impacts their memory and their concentration, let alone the physiology aspects as it relates to lungs and cancers and so forth. But what we're seeing is that there has been an increase in utilization within our adolescent population. And as a result of that, the government in our 2025 throne speech indicated that we will take steps to legislate against flavored vapes, which are purely entered into the marketplace for the purposes of enticing youth to consume.
Yeah, so you also mentioned about the lung capacity for young people, and keeping in mind that young people have not sincerely matured 100%. And so here you are ingesting this, putting this in your lungs haven't fully matured. And so what damage are they doing to themselves?
They anticipate from the studies that the long-term damage is horrific. And in addition to the part that I spoke about insofar as it impacts your concentration and your memory, and your brain hasn't even fully developed as an adolescent. But likewise, as you said, with respect to your lung capacity. So the long-term effects are severe, not least of which it can be used as a gateway for persons to then consume tobacco.
So, Minister, there was a study done some years ago in reference to young people in UK, starting off with these e-cigarettes, and then it became like a gateway drug to cigarettes and, of course, other things. You want to expand on that for us?
Yes, there's quite a lot of evidence to support the use of vaping has changed from its initial intention. It was initially introduced as a smoking cessation, as an aid to persons that wish to smoke, to stop smoking. However, again, through the marketing and social media and the addition of flavors and so forth, it became more enticing and attractive to children. So it completely went contrary to the whole issue, to the whole purpose of its initial introduction to the market. And so we're seeing in many jurisdictions that there is a correlation between utilizing vapes, then transitioning into tobacco and transitioning to other products, which are all dangerous to the body.
Right.
And so that study is just one example, an illustration of the impact, adverse impact that vaping can do when persons start at a young age.
Okay. So you mentioned in the throne speech that this is one of your biggies. You're going to be really focusing on this. How is that coming along? How is that? Are you doing like a blitz to talk to the young people about this? What is your campaign?
We are working with education, obviously, but for them to help to drive this message. We have started the process as it relates to trying to remove it from the shelves, first and foremost, and ensuring that the pharmacists are the ones that are able to sell this product. We will continue with the discussion and the promotion insofar as allowing persons to recognize how dangerous it is, particularly to adolescents. And that's our main concern, is the adolescent youth population, because of the public health issues and the risk involved. So we will continue with that education part. We will also continue reminding retailers that exactly to abide by the law, because that is it. So once we pass the legislation, we will continue to educate the public about the dangers of vaping. We will also, like I said, in conjunction with the Ministry of Education, work with them to allow for us to continue the messaging as it relates to this. And we just need people to understand that it's a very, very serious thing, and we need to address it immediately, which is why we've put it in our 2025 throne speech.
So the argument may be made that, well, it is used as a cessation for, I'm assuming, adults to curb back on smoking. Do we have data that says that does work, or how is that working out?
From what I understand, there have been people that have found success in that. But again, like you say, it's under medical supervision through the for the adult population. We're more concerned about the children. And as a smoking cessation, when it first was introduced, I think the flavor that was introduced was menthol. Now all of a sudden you've got
watermelon, everything.
Precisely. So who is that designed to really appeal to?
Alrighty. So what other nicotine products are out there that you're concerned about as the Minister of Health? Okay,
so in addition to the vapes, we're finding nicotine pouches that are also within the flavored sphere of candy.
Pouches?
It's like looks like a little pouch, and you stick it between your they're in the shops, and you stick it in between your gum. And some of these have more nicotine per pouch than like a pack of cigarettes. Like they're extremely heavily contented there's a heavy content of nicotine in them. Of course, there's the nicotine gum. There's a number of products that are on the market that we need to address so that...
and these are, again, cessation items, right? The nicotine gum?
Well,
yes? No?
The nicotine gum is, yes.
Right,
and they were, again, introduced primarily as a menthol flavor. But now when you start trying to use other types of flavoring, you have to ask, what was the purpose of that? Why do you need nicotine gum that's bubble gum, or the pouches that are cotton candy?
I'm going back in my mind, and I remember snuff. Is that the word? Snuff, like you put it in? Yeah. Showing my age. All right, we're going to take a break, and we'll return with the minister to discuss the impact vaping is having in our community. Stay tuned.
There are a lot of temptations facing young people today, like electronic cigarettes and skateboarding. Each vape pod can contain the same amount of nicotine as a pack of cigarettes. This can lead today's youth to a lifelong addiction and severe lung damage. Recall and consider the facts before making a poor decision.
The health class film guy isn't the best person to talk to your kid about vaping.
Got a few minutes?
You are. Start the conversation with your child about vaping today.
So we ended our first segment talking about the other nicotine products that are out there, and you mentioned that there were pouches, which kind of took me back. I was thinking about the snuff that the young guys used to do. So why should we be wary of these? Because, so yes, we can do a whole blitz on sort of eliminating or getting the use down for vaping, but they're going to go on to something else. So what else can we do? Why are these so dangerous?
Well, again, we need to just continue basically watching the space, because we started with the vapes, and now we're seeing the pouches, we're seeing lozenges, gum, all of these things. Again, they were initially introduced to the market as a smoking cessation aid, right? However, because of through social media, the colorful marketing, the flavors, that's obviously designed to attract a younger audience, right? So it's deviating from the initial intent when they were introduced in the first place.
Right.
And we can't emphasize enough the dangers. Nicotine is highly addictive. I know we know people that have been smoking for years and they've just, so we know from evidence that it's a highly addictive chemical. We also know that the impact on the adolescent as it relates to their brain development, their level of concentration, memory, etc., as well as the lungs. There's cancers that are involved. The health impact it can't be understated. And the whole issue as it relates to the way that it was marketed and manufactured is specifically designed to attract a younger audience.
Right. I hope everyone understands that. The marketing, I'm definitely not an advocate for it, but you have to give the tobacco industry, they've done their job as far as getting young people addicted to this.
Another generation of addiction.
Another generation.
Exactly. Yeah.
So legislation, let's put our minds with that. What is legislation going to be looking like to cease this among our young people?
Right. So as I mentioned before, in the 2025 throne speech, we did indicate that we would be looking to pass legislation to restrict the flavored vapes. Okay. Again, we recognize that it was first introduced, maybe menthol was the only flavor as a smoking cessation aid, but restricting the availability and prohibiting the sale of flavored vapes, the cotton candy, the ice cream flavor, the chocolate, etc., which are, again, designed to attract a younger audience. So we're looking at that. We're also looking at legislation to ensure that the availability of vapes aligns with the Tobacco and Control Act, because under the Tobacco and Control Act, you must be 18 to be able to purchase tobacco products. And right now there's a little bit of uncertainty in the legislation as it relates to when you can purchase nicotine. So we will clarify that in our legislative amendments as well.
So you need ID to get these things, I'm thinking. Do we? Don't we do that?
Well, ideally, that would be if they're legally sold, as the Pharmacy and Poisons Act requires, by a pharmacist. If a pharmacist is uncertain as to the age of the individual, they're likely to question it.
Yeah.
But if it's sitting at the chocolate counter, at the checkout, we've seen them all.
We've seen it.
It is unlikely that anybody's going to ask. That's why they're made just so available. It's unlikely that anyone's going to ask for ID when you're purchasing your chocolate and your mints and your products. They're right there.
Yeah, and it saddens me to see that, to be honest, because young persons and children sometimes they don't look their age. They look a little older. They look over 18, and a person innocently say, okay, here. Not a big deal. The person's only 14 years old, and you sold them something. How are you monitoring the sales? How are you dealing with this from the government's perspective?
Well, with respect to the pharmacists, we've got the pharmacy inspectors that are there that are ensuring through their evaluations of all the licensed pharmacists that they are sold and that the products are behind the counter at the pharmacy, et cetera, et cetera. And likewise, with respect to retail, we are taking steps to ensure that our enforcement officers under environmental health are going into the retail establishments to ensure that these products are not in the retail establishment, but they're actually in the back by the pharmacy counter. So we are enforcing the law.
Okay, so what's going to happen when I'm an investigator and I actually see this? What's the consequence to these to these shops?
Fortunately, the majority have been compliant, and when they receive the letter in the first instance saying, "We're reminding you it's unlawful for you as a retail establishment to be selling these nicotine products here," the majority are compliant. There are some, unfortunately, that are outliers, and those are the ones that have to be addressed through the law.
And I'm thinking through the black market, this has really exploded, yeah?
Unfortunately, yes.
And so how do you deal with that?
Well, again, we're just continuing to legislate, and hopefully through legislation and enforcement we'll be able to minimize it. But as with almost every scenario, there's always going to be somebody that's going to try to find a loophole or do something unlawfully.
Yeah. So what is the consequence for a young person being caught with vapes or nicotine? Is there a consequence? Let me start off with that question.
As a matter of law, at this point, no.
Okay.
But there's a consequence for somebody that's selling it, i.e., if you are a retail establishment and you are selling these and you're not allowed to. Remember, it's only supposed to be sold at the pharmacy. So there could be consequences in that regard. for the retail establishment, but for a child, obviously, if it's at school, as you've indicated, there are consequences there.
It's definitely there. It's definitely there. It upsets me. I'm thinking of a young girl, and keeping in mind I'm aware of paper, but I'm just thinking of a young girl that was like, I don't see what the big deal is. I just remember her saying to me, so I did that. Like, and you try to explain the same thing, same discussion we've had, how you're affecting your lungs, your brain. They just don't see it.
Yeah.
And then the parent is like, I don't, because they're most likely maybe doing it, or it's around the house. And so I don't know how we're going to be able to penetrate that, because that's the issue that we're facing.
Well, I think we got to continue with the education. Programs such as this, bringing a lightness and awareness to the community, will help for us to just educate the public about the dangers of vaping, particularly as it relates to our adolescents.
So what are 3 to 5 facts you want us to know about vaping and the impact on our young people, if you could just...
Certainly.
Yeah.
Again, I have to emphasize the dangers associated with it. The fact that many of them contain nicotine, which we know is a highly addictive drug. And the health consequences as a result of consumption of nicotine, we recognize it adversely impacts an adolescent's brain development. It impacts mental concentration and memory. So you can't perform well in school if that's impacted because of your consumption of the nicotine. And also just recognizing, as parents, we need to be vigilant and ask the questions and see what our children are doing, and recognize that this is very dangerous. And to compare it to cigarettes and say, well, it's less dangerous than cigarette. It's dangerous. You still have the word dangerous in your description.
Yeah.
So as parents, I think we also have to be vigilant about these products that are on the market, and ask questions and speak to our children, or the ones that we have within our charge, and say, listen, this isn't safe, this isn't good, and it will adversely impact your life.
I do appreciate you coming on the program. I really do. This has been a topic that I've really tried to push to the forefront, due to what, as I said, what I do is for a living. But I think the children do it. I get that. But the parents, how am I, or you, or whoever, are going to reach the parents to say, hey, your kid shouldn't be doing this.
Right.
Yeah, so.
Again, it's just about health promotion and education, and reminding them that, similarly to like you said, in our age, when we saw thousands and hundreds of thousands of people dying of cancer every year because of tobacco consumption, this is also a nicotine product that is going to adversely impact their health of their child.
Right. So anyway, I thank you so much
for
joining us. Any final words you want to leave our audience with about vaping?
I think, again, as parents, educators, persons that have young people within our charge, we just have to be conscious of the fact that this is a very serious issue, and that we can perhaps help to address it by openly communicating with our children, observing and reminding them of the adverse health impact that this will have on them.
Minister, I do want to thank you for being here. I think you've shed a lot of light on this. This is a very important topic for not just educators, but for all of us that deal with our young people. Thanks again for stopping on by. When we return, we'll be talking with Miss Azuree Williams, Education Officer for Bermuda Cancer and Health. Stay tuned.
Every day, thousands of kids start vaping. And I can't let this happen to my kid. Of course, it's awkward to talk to your kids about the dangers of vaping. Hey, bestie, how's sketch is vaping? It's hard to get their attention. Ready? Go. Yes. Look at that. You even turn yours over. So if you want to talk to your kids about the dangers of vaping, you got to get it trending.
No, you're doing it wrong.
Let's go.
Can we talk?
Yeah, what's up?
Visit talkaboutvaping.org for tips on when and how to have the vape talk.
You're watching CITV.
Hello, everyone. Thank you for joining us now as we take our conversation to Miss Azuree Williams. You will recall she is the Education Officer from the Bermuda Cancer Center. And we're going to continue our conversation on the dangers of vaping. Wow. So you were telling me off air that you attended a big concert, and so it's interesting because I didn't realize it was that in the air, and I should, because if we're comparing it to cigarette smoking, which, you know, if you're in a concert or anything and you do smell the smoke and it does affect you, and you were basically saying it's the same thing with vaping.
Yeah.
So talk to us about that.
So you have secondhand smoke from cigarettes and you have secondhand smoke from vaping. And I used to live in London for a little bit, and over the years, just traveling back and forth, I've seen the increase in vaping vendors all over London. I mean, you can't walk a block without hitting multiple stores that are selling vape products. And, you know, firsthand at a music festival recently, and the amount of young people, whether they were teens or young adults or even older adults who were smoking. I saw all ages, vaping. We did see a lot of people smoking cigarettes, but there were definitely by far more people using the vapes. And as I mentioned, you have that secondhand smoke from cigarettes. You also have secondhand vape inhalation. And I experienced it, and that's where you feel those short-term effects. I was getting headaches because I had people in front of me, people behind me, people to the side of me. I mean, every 5 people, I swear, like they were vaping. It was insane. It is definitely an epidemic when it comes to vaping. It's just increasing, especially among the younger populations. And I felt the headaches while I was standing there. You know, my eyes were starting to get itchy, and I was constantly trying to move and find a free space, but it was so difficult to move away from people because everywhere I turned, there was someone vaping. It was insane how many people were vaping. So when we look at short-term effects of vaping, it's not just the individual who's vaping, but even bystanders, people who are inhaling that.
They get affected by it as well.
The secondhand vape product that's coming out into the air, and you can have nausea, those headaches, coughing. I had that while I was at the event, unfortunately. When I finally found a space away from people who were vaping, I didn't have those issues, but I definitely felt it.
So those are the short-term effects that basically, if you're in a concert of that size, I'm sure you're gonna get affected by it. Let's talk about the long-term effects. So
long-term effects would be serious lung disease. Asthma can be one of them. Bronchial issues. This is the same thing that you can get from smoking cigarettes as well. It's very similar, the side effects, the long-term and short-term. We've seen even some of the research and data that's out there, the NIS, there are journals out there, medical journals, and they have research. And the research is still relatively new. I mean, vaping has been around since 2003/4, introduced by a chemist to help as a cessation device for people who are trying to kick the habit of smoking. But when we look at the data and research that's out there, we are seeing direct links to different cancers, whether it's breast cancer, we have oral cancers. Some of the data, I mean, it's still ongoing, it's still fairly new, and there's not enough to give a concrete conclusion that vaping is, but when we look at the ingredients that a vape cartridge is composed of, there are lots of carcinogens that are involved. Not the nicotine is the addictive portion of vape juice or e-juice. However, when we look at what the actual ingredients are, there are so many ingredients in vape products that are also in cigarettes that are also carcinogens. So if cigarettes cause cancer, carcinogens cause cancer, that's what the word means, then we can definitely safely conclude that vaping is going to see more and more cancer cases down the road. I feel it's inevitable, and the research and the data is definitely leading in that direction. So
one of the topics I had wanted to bring up with the minister that was just here previously to you was the mental health challenges that one that affects the young people with. If you could talk about that, because we got into something else, but this is so like, wow, like what's going on there with the mental health challenges?
So we at Bermuda Cancer and Health Center have many education programs, and one of the programs that definitely dives into this is the Lung Smart program, and we address the dangers of smoking cigarettes, marijuana, and vaping, and the impact that all of them have on young people in their brain development, and also it impacts their emotional development. So nicotine has a huge impact on the brain. It attacks all of the brain's receptors. Some drugs and some other substances that are out there only impact certain parts of the brain, but when we're looking at nicotine, it impacts the entire brain. And then when you're looking at young people, their brains are like plastic, they're malleable, they're still being developed. And the more they are ingesting nicotine into their system, it takes 7 to 10 seconds for nicotine to hit the brain.
Wow.
And the more they're doing that, the more they're becoming addicted, because nicotine is addictive. And that means that they're putting themselves more and more at risk for mental health issues as well, because that impacts their brain. So depression is definitely a biggie amongst young people, specifically teens, adolescents who vape. There is a definite higher diagnosis of depression in young people who are vaping. I've seen this data from certain parts of North America, and even here in Bermuda, you're seeing therapists who are dealing with young people who are severely depressed, and these young people are, yes, having issues in their personal lives, but they're also vaping as well. So there is a strong correlation with vaping and depression. There is evidence and data out there for that as well. But again, this vaping is still kind of new. It hasn't been around as long as tobacco consumption. There have been so many tobacco control laws put in place. So hopefully more and more will be coming into place for control laws for vaping as well, because the impact is huge on the young person's brain.
It really is. And I'm talking locally here in Bermuda. Like every year, it just seems to get more and more and more.
It's intensifying.
It really, really is. So what are some warning signs that a young person is actually vaping?
Definitely tired a lot, always wanting to sleep. That's something that's definitely typical for teens, so it may not necessarily be vaping. If a teen is active with sports and then all of a sudden they lose interest, it could be something else. But there are links to lack of sports and a decrease in interest in sports, not having the energy for sports with those young people who are vaping. Bad breath, their clothing, sometimes the vapes, because they come in these fruity flavors. Parents, educators, people who work with young people, they need to be looking out for those signs, looking out for changing attitude and behavior. Again, that depression, it's a cycle. So nicotine gives you a good jolt, and the person who is vaping, they feel great when they have that nicotine, but then the minute that wears off, that's when the depression kicks in. So they need to constantly keep taking a hit after hit after hit. So definitely parents and caregivers of young people, anyone who's involved with young people, they really need to tune in, hone in on different signs. They could be very subtle, but you just never know, and start having conversations.
So you talked earlier about being at the concert and the secondhand effect that vaping has. Let's talk about that, because I don't think people, you know, from the way I look at it and talking to individuals, oh, it doesn't affect me. But if somebody's vaping next to you, go ahead and talk about that for us.
It's difficult because, you know, I've experienced it firsthand, and me, based on all the research that I have to do for work, even traveling overseas, going to different conferences, and then also shadowing the American Cancer Society volunteers on Capitol Hill for Lobby Day. I've been fortunate to be able to experience that. Vaping has been on the rise steadily since about 2018 in North America. And there were many deaths in the summer of 2019. And in 2019, I also was able to shadow those American Cancer Society volunteers, because we have a partnership with them through Relay for Life. And the increase in the intensity of not only deaths, but lung disease among young people
has increased.
Yes. Yeah. So we've seen in North America, more and more pediatricians are saying that they have young people, whether they're preteens or a teen, coming into the doctor's offices, the pediatrician's offices, with an increase in bronchial and asthmatic issues that they never once had. Or it's intensified, it's exacerbated because of the vaping. And that's from first-hand use. But then the second-hand, where you're standing next to someone, like you just asked me, you know, feeling uncomfortable, you know, it really was impeding me enjoying the experience. Because I knew that people would be smoking outdoors, but the vaping, it was just so prevalent at this outdoor festival that it stunned me. I know that it's something that's prevalent, but just the amount of people, because I haven't experienced that in Bermuda. I've experienced a lot of people vaping at different events, but this event, because it was tens of thousands of people there, and everywhere you turn, people were vaping. It just was like, oh my goodness, I need a mask, I need goggles or sunglasses or something, because it was hitting my eyes and I could feel the irritation in my eyes. And then it hit my nose and I could feel my nose getting irritated. So as much as it was a great experience musically, as far as socially and the direct environment and its impact, it was quite difficult to breathe a bit. We had to keep finding spots where we can enjoy the experience without having that impact of inhaling that secondhand vape. Yeah.
So we were doing a little research before you came on, and we were looking at other jurisdictions that have actually banned vaping. And so just want to get your personal opinion prior to us going on the break. Do you think we should ban the flavored vapes altogether? Why or why not? Especially to our young people. I know the minister touched on it. What's your opinion on it?
Well, even though vaping was initially introduced as a cessation device, it has not been FDA approved as a cessation device. Therefore, why would, if a body like the US FDA has not approved this as a cessation device, wouldn't we want more legislation to ensure that we are protecting our young people, their development, their health, their risk for cancer and other lung diseases? It's definitely something that we should be looking into, because there are so many countries that are seeing this prevalence in vaping amongst young people, and it's getting younger and younger in age. You know, UK is putting more bans in place, age bans. You know, you can't be under 21 in some countries to purchase it. Flavors are being banned in some countries because the flavors are appealing to the younger crowd. So yeah, definitely it's something that Bermuda's government needs to be looking into, which they are.
Yeah. All right, we're going to take a break. We are talking with Azuree Williams. She is, of course, the education officer with the Bermuda Cancer Center. We'll be right back.
There are a lot of temptations facing young people today, like electronic cigarettes and skateboarding. Each vape pod can contain the same amount of nicotine as a pack of cigarettes. This can lead today's youth to a lifelong addiction and severe lung damage. Recall and consider the facts before making a poor decision.
The health class film guy isn't the best person to talk to your kid about vaping.
Got a few minutes?
You are. Start the conversation with your child about vaping today.
Thank you for joining us once again. We have Ms. Azuree Williams, who is, of course, the education officer for the Bermuda Cancer Health Center, and she is talking to us about the dangers of vaping. Wow, this topic has been, like, I think you're honing in on a lot of stuff that a lot of people don't know about. So our producer was talking to us about, he wanted to know if there's any vape products out there that don't necessarily have the nicotine, but have other substances that you feel are harmful?
So,
Yeah.
there are products that are advertised as zero nicotine, but evidence shows there are trace amounts of nicotine. But again, when it comes to certain products, you don't always have to put the amount or what's written. What you see on a label says one thing, but then you don't necessarily know what else is in there. So there are products out there that say 0% nicotine, but it's been found that a lot of those same products have trace amounts of nicotine, which still can get anyone addicted because that's what nicotine does. And then we look at what are the other ingredients, what are the other chemicals inside the e-juice or the vape juice. You'd be surprised. Formaldehyde, also found in a cigarette. Formaldehyde is a carcinogen. It causes cancer. Formaldehyde is used to prevent the deterioration of organs.
Right, that's what I thought.
So they use it in embalming in the funeral homes or funeral parlors. We also have different pesticides and herbicides such as acrolein that's used in gardening as a pesticide and herbicide. No one would necessarily consume that. You have heavy metals that are also found in the e-juice, and then even something like, let's say, have you ever watched in the wintertime, if you're sitting on a plane or you're waiting for your plane to be prepped and ready, there's ice all over the plane, and then they have to de-ice it.
Yes.
So the chemical de-icing of a plane, of an aircraft,
that's in it too.
The liquid that they use for that is included in almost every vape juice that's out there. It's so much stuff. There's an ingredient also included in vapes that's called diacetyl, and that is something that's also found in cigarettes, and it's one of the leading causes of popcorn lung, which is something you find with cigarette use, but you can also now see the side effects of that, long-term effects of vaping, also being a leading cause of popcorn lung if you have someone who's vaping steadily, and most vape juices contain that same product, diacetyl, then you're gonna have almost the same things and trends you see with cigarette consumption or tobacco consumption. It's almost, you can see that same trend happening with the vaping consumption as well. And also included in one of our presentations, the Lung Smart presentation in particular, I've included a clip from one of the UK morning shows.
Okay.
And they've interviewed a 12-year-old and her mom. The 12-year-old almost died from vaping.
Yeah.
Heavily addicted. She first tried it when she was 9, liked it, but didn't continue it. Then when she started high school at the age of 11, 12, in the UK they start at that age. She started sneaking it in the bathroom. Her mom didn't know what was going on until one day, they found these devices in the room and they started confiscating them, and then they would punish her and take away her cell phone. They didn't know what to do, and then one day she became so out of control. She could not breathe. Her breathing she was struggling heavily, and she was already asthmatic. They had to rush her to the hospital. One of her lungs collapsed.
Oh my gosh.
They had to put her in an induced coma, and she was in the hospital for about a week or two.
Wow.
And at the young age of 12, she almost lost her life to vaping. And in 2019, there was such an uptick of deaths in 2019 in the United States due to the street vapes. People buying black market vapes, not being aware that, and specifically the vapes that were causing these deaths in the U.S. were directly linked to THC, which is that.
I think you've talked to us about that, but just reiterate that if you.
Just in the active ingredient found in marijuana to give you that high, and so many people were buying that, and one of the things also with vape cartridges or the e-juice or the vape juice is some people buy it for CBD, which is that relaxing component of marijuana, and it doesn't have those high side effects. So when people are using that, yes, that may be the positive side of vaping, but you also need to find out what else is included in that vape juice, because it's not necessarily 100% CBD. Sometimes there's THC, sometimes there's nicotine. There are other harmful substances. Young people have to be mindful of. A vape can explode because it's an electronically heated device.
That's you brought up a good point, because I know when you're traveling, and some people, I think they advise you not to put it in your luggage or something to that, one or the other. I kind of remember something about that.
Well, you have to make sure the devices are turned off,
that makes sense.
sometimes, you've had people have vapes explode in their face.
I've heard,
because they're heated devices. They're electronic devices. They can malfunction.
Right.
They are more dangerous than just what you're internalizing and consuming, putting into your body, and also thinking when it comes to the dangers of your lung, the particles that are produced from the vape. When you inhale, those particles are very microscopic. They are so tiny. They're very minute. You can never get those out of your lungs. They're permanently embedded into your lungs. So the young lady in the UK who shared her story on the morning show, she has permanent damage to her lungs. One was completely damaged. She only has one strong lung, and she will be like that for the rest of her life, unfortunately. Yeah.
Wow. So you give us a great segue. What can we, I don't know, which should I go to, the parents or the schools? You take your choice.
All of the above.
All right, go ahead.
Of the above.
All right, let's start with the parents, because that's where the kids spend most of their time, I think.
Yeah.
What can parents and caregivers do to be aware of it and to prevent it, I guess?
Again, as I mentioned before, looking at the behavioral changes. Sometimes it's not vaping. It could be bullying. It could be all sorts of things that go on in schools with young people. But just being mindful, looking at different chargers that don't necessarily go to a regular phone, different devices that you may find laying around that's not necessarily a typical cell phone or other device that you're familiar with. It could be something that looks like just a typical pen, but it may be a little heavier than usual. It could be a USB device. It looks exactly like a USB or a thumb drive, but it's not. And then if you notice these behavioral changes and different mood swings or whatever with your young person, having conversations, staying calm, not being accusatory or judgmental, because then the minute you come with that, they start clamming up and shutting off and don't want to share. And then there are also free programs online. So go to reputable resources like the American Lung Association, because they're dealing with lung damage and lung disease. And they have a full free program that's online for educators and parents to take. I've taken the course. It's really, it's palatable, it's comprehensive, it's really easy, it's broken down for anybody could pretty much
Do you have a website
go
for
through the
that?
course. It's the American American Lung Association's website. I can't remember.
And then just go on there,
Yeah.
and then you should be able to find it.
Yes.
So from an educator's point of view, I've already invited you. You're going to be in school at the beginning of the school year. So, like, if other educators want to get in touch with you, what should they do? Just
go to our website. We have free sign-ups if you want to book a free presentation. Our website, cancer.bm. We have a link where you can book a free presentation, or they can call our center, 236-1001, and ask if they can book a free presentation for LungSmart at their school, at a community event. It doesn't have to be just in the school. We even do lunch and learns for adults, so that the parents and the educators are aware of what young people are
book you
into.
for that too.
Yeah.
Yeah, we'll definitely book you for that. So, are there any, like, I know you're from Bermuda Cancer and the Bermuda Cancer Health Center. As far as counseling programs, do you assist with that for vaping? I know you do that for cigarette smoking, but
There, as far as I know, in Bermuda, we don't have any cessation programs on island. But again, American Lung Association, they have programs. Yes, they're based in the United States, but they do have online resources, and there are online programs out there as well, outside of American Lung Association. But the resources are out there.
You just have to take advantage
Yeah,
of it.
yeah.
You also mentioned that the churches can get involved. Talk a little bit about that if you can.
Anybody in the community
Yeah.
that's dealing with youth and young people, really, your caregivers who are entrusted to help guide the young people on a positive path. And it's not just, when we're looking at the church, not just a spiritual journey, but also looking at their health and their mental health.
Right.
Vaping impacts both. They can have mental health issues down the road with depression, amongst other things, not being able to perform with their academics and also with sports life. If you have someone that's a great athlete and all of a sudden that changes,
look out for
and they
those
don't
children,
have an
yeah.
injury, you really need to investigate and ask what's going on. And they may need some sort of counseling and therapy, and then doctors can also give.
It has to be a group, a whole community.
We all need
deal
to
with
be
this.
working
We
on this
have to.
together.
I have mentioned earlier in the program, I have seen the increase of vaping amongst our young people.
And getting younger and younger.
And getting
with the
younger,
age.
yeah. I remember an article in the Royal Gazette was on the front page. I remember you sending me an article on this. So this is dangerous, guys. And it may not affect you personally, but it's affecting the whole community.
But when you think of cancer and the impact, right? How 1 in 5 people will be diagnosed with cancer in their lifetime.
Right. So.
And the fact that vaping is linked to cancer, we do have to take this more seriously.
I think
almost
so.
everyone we know, I should say almost everyone out there knows someone who has either had cancer or been impacted by cancer as a caregiver or, a healthcare provider. So vaping's unfortunately not going anywhere, and we really need to take heed, address the issues, book a Lung Smart presentation for your class if you're an educator, or for the entire school. We really focus on the older groups, so 11-year-olds and up.
As young as 11, as young as 9, it happens. Yeah.
So it's definitely something that's critical, and we don't want to wait until the boat is leaking. I mean, it's already leaking. We don't want it to sink, so we really need to get on board, help each other out, and support each other as a community. And thankfully, the Ministry of Health is on board.
Thank you, yeah.
To ensure that, they're doing their part as far as legislation, because that's important. If we don't have that, what do we have as a foundation?
Agreed.
But parents and educators, you got to do your part, watch for the signs, and have those difficult conversations, and sign up for these courses that can help you have the difficult conversations.
I'm actually going to do the one on the Lung Smart program. Yeah, I think I'm going to delve into that one. Alrighty, I thank you, Ms. Azuree Williams. She is, of course, the education officer for the Bermuda Cancer and Health Center. She was our second guest, and our first guest, of course, was the Minister of Health, the Honorable Kim Wilson. I'm Shay Dawn Burgess, and this has been Health and Family.